How is latent TB infection different from active TB infection? Have you ever wondered about the differences between latent tuberculosis infection and active tuberculosis infection? Understanding these two forms of tuberculosis is essential for effective diagnosis and treatment. Let's break it down. Latent tuberculosis infection occurs when a person is infected with Mycobacterium tuberculosis bacteria, but these bacteria are inactive or dormant. Individuals with latent tuberculosis do not show any symptoms. They feel perfectly healthy and do not experience signs like cough, fever, weight loss, or night sweats. This form of tuberculosis is not contagious, meaning those with latent tuberculosis cannot spread the bacteria to others. The immune system keeps the bacteria in check, preventing them from multiplying or causing illness. To detect latent tuberculosis, healthcare providers use immune-based tests. One common test is the interferon gamma releases assay, which checks how the immune system responds to tuberculosis proteins. Another method is the tuberculin skin test. Without treatment, latent tuberculosis can progress to active tuberculosis disease in approximately 2% to 23% of cases, especially if the immune system weakens. Now let's talk about active tuberculosis infection. In this case, the bacteria are active and multiplying, leading to noticeable symptoms. People with active tuberculosis often experience a persistent cough, chest pain, coughing up blood, fever, night sweats, and weight loss. Unlike latent tuberculosis, active tuberculosis is contagious. It can spread to others through airborne droplets when an infected person coughs or sneezes. Diagnosing active tuberculosis typically involves chest X-rays, sputum tests, and molecular tests like polymerase chain reaction testing. Treatment for active tuberculosis requires a longer course of multiple antibiotics, tailored to the specific drug susceptibility and severity of the disease. Because active tuberculosis poses a public health risk due to its infectious nature, prompt medical intervention is crucial. In summary, the key differences between latent tuberculosis infection and active tuberculosis infection are clear. Latent tuberculosis is dormant and asymptomatic, while active tuberculosis is characterized by symptoms and contagiousness. Understanding these differences is vital for controlling tuberculosis effectively at both individual and community levels. If you suspect you have been exposed to tuberculosis or have concerns, it is always best to consult a healthcare professional for personalized advice and testing.